on food security, natural resources management, including climate change, and strengthen the capacities of national services by training their staff and providing logistical and financial support.
The government of the Gambia attaches high importance to food security as clearly spelled in the program for accelerated growth and employment. A clear proof is the implementation of many agricultural projects in the country.
Food security constitutes a significant part of national security, and no government will ignore good security or food security nor afford to wait for the 11th hour to reach on food security matters. For governments to ensure national food security, first and foremost, the citizenry should be aware of the stakes involved in producing their food. In the Gambia, His Excellency Professor Dr. Alhaji Yaya A.T. Jammeh, through his visionary leadership, has during the very early stages promulgated that the policy statement entitled Back to the Land, grow what you eat and eat what you grow. The simple reason behind this statement is that the food supply imported into Gambia comes from a surplus production of the exporting countries. When the exporting countries face situations of insufficient food production, they will be obliged to first meet the demand of their citizens.
Information on future food production and availability is key for national decision-making. Therefore, providing farmers information on the use of meteorological products and data generation to serve in decision-making will in no small measure help to improve and increase the quality of food production in the sub-region. Participants are tasked to show commitment and dedication to the training, since they will serve as trainers to the rest of their communities in the sub-region. Uminjai, GRTS.
Over 300 residents of the Central River Region settlement of Jarumekoto over the weekend received treatment for a range of medical conditions at no cost. The free medical services aimed at supporting government efforts at ensuring a healthy populace were provided by a caravan of compassionate health workers from the Nyani Free Medical Team. Louis Mendy reports.
Of kilometers to reach out to patients in hard-to-reach communities is seen as a worthy cause. A team of medical personnel from the Nyani Free Medical Team were over the weekend met by scores of patients in Jarumekoto in the Central River Region who were eagerly waiting for them to arrive to receive medical treatment. The team, constituting doctors, surgeons, and nurses, who tasked themselves with the responsibility of giving free medical care to the underprivileged in hard-to-reach areas, has since the beginning of the campaign attended to hundreds of patients in the Sami district.
I have seen almost 80 people with different types of conditions. The cataract that needs operation is about 11 of them. So I am referring them to Bansan Hospital or anywhere they feel they will, because some of them have their relatives in Banjul. It's far. This is why we want to come here to help those people not to go up to Banjul.
The routine voluntary outreach to these communities enabled these young medical practitioners who have carved a reputation as passionate health workers with the formation of this self-sponsored charitable organization to care for their relatives who, in one way or the other, supported them through. They described the move as a way of complementing government's effort to make health care delivery accessible to all and sundry.
This is to supplement government's effort. You know, government cannot do all. We, as citizens of this country, should take such venture. I want to tell you that this money comes from the people who came here. We took some of our salaries and buy some drugs. Some philanthropists also helped in order to come here and serve our people.
On arrival at the local health center in Jarumekoto, a village situated just 4 kilometers outside the historic island town of Kujanjambure, would-be patients from more than 6 kilometers were already docked in anticipation of the medical team, ready to attend to such cases like malaria, cataracts, body pain, to name but a few.
People that had, for example, malaria, it would have been very late if they were not diagnosed timely and also treated on time. Okay, and that could have led to other health implications. For example, the patient would have suffered more and it can also lead to death if action is not taken immediately.
Their intervention endeared them to the locals, especially the elderly, who had to contend with the inconvenience of regular visit to nearby health centers. They expressed joy over the package while hailing the efforts of these young health workers for their role in fast-tracking government's efforts to enable healthy nations. The medical caravan, bent on helping government in mitigating health-related problems in hard-to-reach areas, attracted a decent number of patients from far and near, speaking volumes about the admiration the people of CRR have for them. Louis Mendy, GRTS.
GRTS has been receiving reports of infernos consuming everything in their path almost on a daily basis, and it seems fire-related disasters are on the increase, especially in built-up areas like Serekunda. Although damage done to property is hardly in doubt, the cause of such devastating fires is usually not known readily. Modu S. Jalo has more.
This is the remains of a building engulfed by fire Thursday evening, leaving the Sisekunda family in Busumbala in utter desperation. The incident left the victims homeless after the fire completely consumed everything in this household. As the family head, Lamin Yabo, narrated, he was sitting outside with the family when one of the neighbors called their attention to smoke billowing from one of the rooms. That was the time, he said, they rushed to find out exactly what was happening. He lamented when they realized the extent of the raging fire had already engulfed the house. The fire and rescue service rushed to the scene, but could not lessen the damage as the fire had destroyed much of the household. This Yabo Bimon resulted to the loss of all his possessions, including the children's uniform and all school stationery. The man's interview with the state broadcaster availed him the opportunity to seek for help from the general public. The landlord's wife, Bella Sise, who also spoke to GRTS, disclosed that the impact could have been less worse if it weren't for the lack of water in the compound, in addition to the wild wind. The desperate woman thanked neighbors who were said to have responded swiftly in putting out the flames before the arrival of personnel of the fire and rescue services. The Imam of Busumbala, Mumudu Lamin Marong, and Lamin Kamara all expressed concern about the loss caused due to the inferno, but they equally saw it as a moment to give thanks to God, for no life has been lost. The blaze barely left anything behind except for the empty building. And as they ponder over the cause of this incident, the victims may need time to put pieces together. With essential consumables and clothing all lost to the inferno, for now, these Busumbala residents are now pinning their hopes on help from humanitarians. Mohamed Estiala, GRTS News.
From there, we'll take our first break. Stay tuned.
Gambia's fastest and cheapest 4G fixed wireless internet. With QCell's 4G, you can access the internet at unbeatable speeds on your laptop or desktop computer. You can also use your mobile or tablet to browse the internet via Wi-Fi. QCell's 4G internet can keep you connected either in your home or in your office. For a limited time, get 50% off regular equipment and 100% off corporate equipment, as well as free installation and free QCell credit. For more information, call 333-3253 or 333-3104. QCell 4G Internet. Fast, affordable and reliable. QCell. Sunibus. The Gambia's quality network.
Welcome back. In Venezuela, the government and opposition are blaming each other for weeks of unrest. Both supporters and opponents of the government have taken to the streets in recent days as President Nicolas Maduro faces his biggest political crisis yet. And one of the controversial characters is former General Angel Vicars. CNN's Carl Penhol has the story.
The roads were jammed to the most fantastical show a fled ruler could put on. They knew they were poor and he was rich, but not like this. Not quite so insultingly extravagant.
I'm the Ukrainian.
We meet Yulia, whose anonymous plea to the world went viral on the internet. Only now she feels safe to say her name.
I am a Ukrainian. I'm 24 years old. My name is Yulia Marushevska. For me, it's a madness. And for all people